Okay, we're going to begin the assessment. We're going to start with your head. We're going to work our way down to the waist. So starting in the head, we're going to be checking the jaw for what we consider TMJ, which is like clicking with the jaw for any abnormalities. So we're just going to have you open your mouth, open and shut. Good. And then push the jaw out and retract it back in. Any pain? I don't notice any clicking, any swelling there in that area. We will be kind of manipulating, touching you throughout this, so if you notice any pain or discomfort, just let me know and we will stop.
Okay.
We're going to move on to the shoulders here. We want to make sure that the shoulders are symmetrical, which they are. Any type of pain as we're palpating the shoulders, we're going to go along the clavicle. You said you did break the clavicle. Was it the right or left?
The right side.
The right side. Any pain, discomfort as I'm moving across there? We'll feel down the shoulders and the tops of the arms where the humerus is, just to make sure that there isn't any type of discomfort which could be indicative of a rotator cuff injury.
Okay.
No pain there. Clavicle feels good. No pain, no warmth you've noticed there, or any swelling. Okay. We'll have you just kind of spin around there. We're going to check the scapula. We're going to make sure that those are even. Any pain, discomfort as I'm moving across. And they appear to be normal in shape and size as well. We're going to go ahead here and we're going to work from the neck area. I'm going to have you put your head, flex it up, extend down to your chest, put ear to one side of your body, and then to the other. Any pain, clicking? Okay. Down the cervical spine here, we're just going to make sure that there's no nodules, bumps. Don't seem to have any bruises or scars on the skin from what I can see. And we'll just move down the spine there. Make sure that everything feels in place. Sometimes the vertebral column there with the vertebrae can get out of alignment, and you'll notice that, but everything feels to be in line. I'm going to have you go ahead and bend down to your toes. And that's just checking to make sure that the spine is in line. Go ahead and stand up there. The spine we want to see have the normal curvature, which is like an S shape, goes concave to convex and back to concavity again, which it does. Okay. Back up to the top of the body here, we're going to move on to the elbows and the forearms here, and that's where the ulna and radius is, and we want to make sure that we do supination and pronation. Any pain or discomfort as you rotate in or out there?
No.
Good. We feel around the elbow and make sure that there's no pain or discomfort. You have no swelling in there. Skin feels warm to the touch. Good. Any numbness or tingling?
No.
Face, hands? Okay.
No.
Also in the forearms here, in the elbows, they do very limited range of motion, but we are going to test to make sure that the strength. And while we're testing the strength, I'm going to have you just kind of put your forearms up like this and kind of resist me pulling away. Any pain there?
No.
Okay, we're also going to have you bring your arms out to the side. Don't let me push you down. And then also out to the front of the body. Good. And that just kind of is back to the shoulders and rotator cuff, because if you did have a rotator cuff injury, this arm would just fall whenever we resist that. So doesn't seem to be any problems there. Another flexion and extension is going to be the adduction across the body and abduction away from the body. And then also we're going to have you flex forward and then extend back with both arms. Any pain or discomfort with that? Okay. Length of the arms. We always want to make sure with your arms that they are the right length, that there isn't one that seems to be shorter or longer than the other. We'll go ahead, we can sit down and we'll move on to some of the more intricate features in the wrists and the fingers. We're going to do a test called Fallon's, which is either in a prayer position or almost like a reverse prayer position where you push the wrist together. Hold that for about 30 seconds and see, do we have any pain or discomfort anywhere? Good. Good. Color in your arms seems to be equal on both sides. You have a nice flesh colored tone, nice and warm to the touch. Arms seem to be very symmetrical. Another sign that we do for carpal tunnel, we did the prayer position already, and then we do what is called Tinel sign, which is it is just palpating the wrist for any type of pain or discomfort down through the fingers, any type of numbness or tingling.
No.
The next thing we're going to move on to is the fingers, and we're going to check each finger joint, making sure that there's no nodules, that they are symmetrical, the color is warm, or the color is good and flesh tone pink, warm to the touch. You haven't noticed your fingers to become blue, what we would call pallor at all.
No.
And the joints all feel good with that. Same as the upper arms, we'll move on to doing a flexion and extension, as well as abduction and adduction in the wrists and fingers as well. So we're going to have you flex and extend. Any pain or discomfort?
No.
And then also abduction and adduction. Clicking, pain, discomfort, numbness, tingling, okay? Yeah. And then also with the fingers, just making sure that they move in a normal way. Another sign of the carpal tunnel is making the fist, putting the thumbs over the knuckle area, and then releasing any type of pain, discomfort, or numbness through there. Good. Okay, well, as far as your physical assessment as well as the health history you gave me, it seems like you are pretty healthy. You're very diligent in exercising. Just some teaching things. I know you said about, your lower back hurting you sometimes, and that can often be due to lifting the wrong way, and we're all known to do it wrong at times. We lift wrong. I know you have a small child, so you're doing whatever to get on the move quickly. We just want to make sure that we're lifting with our legs, we're bending our legs and lifting instead of lifting with our back to prevent any type of injuries. The same with at your yoga sessions. Make sure that you are bending and stretching the way that they are teaching you to do that. Another thing is just in normal everyday life, making sure that we're safe to prevent any type of traumatic injuries, wearing seat belts, taking any kind of special precautions as far as climbing on a ladder or anything where you could injure yourself.
Okay.
Proper posture as well, having your shoulders back, sitting straight, that's going to help to keep that nice curvature of the spine the way that it should be.
Okay.
Keeping your annual checkups. Make sure that you're getting to your general practitioner for an exam, and if you would have an injury, maybe try those pharmacological means for a short period of time, do an over-the-counter Motrin or something as directed on the bottle. But if it is severe, if that pain is unrelieved, make sure that you do seek treatment sooner than later. Proper diet. As we are both women, we know that we need that calcium. We need a good protein, balanced diet, carbohydrates, and our good fats as well. Vitamin C and D, those are also going to be helpful in maintaining a good, healthy body for the duration of our life.
Okay.
You already said about exercise. That's wonderful. We need you to be exercising at least 3-4 times a week. Having good water intake, not having those sugary sodas, teas, things like that. Maintaining a good weight and a good BMI. The more overweight, obese that we are, the more likely of getting things like osteoarthritis and problems with the joints. Doesn't sound like you're a smoker, drinker, but, if you do partake in those things, make sure that you look to decrease the amount, and if not, to get some smoking cessation or alcohol decrease from your alcohol use, as that could affect your joints and muscles as we progress through life. So I think that is the completion of our musculoskeletal assessment, and I thank you for coming in today.
Thank you.